And hello and welcome along. Hi, this is Kathy Frey from IMCO, from the International Integrative Maternity Healthcare Organisation, and welcome along this week to Dr. Sunita Osborne. Say hello, Sunita.
Hello, thank you for having me.
It is really great to have you here. And for those of you who are regular with us, you know that we've just had a little break of the live webinars. Because I've actually been away on a really special holiday, but we're back in the groove, and it's neat to have things ticking along again. And so I know that a lot of you will be watching this webinar not live, you'll be watching it a little bit down the track. So welcome back and welcome along. So most of our audience are professional maternity healthcare clinicians of some modality, but we do also have women who are pregnant or have been pregnant who touch base with these webinars as well, and everybody is welcome. So if you have any questions today for Dr. Osborne, please do just type them into the little chat box at the bottom, and or the chat box or the Q&A, it doesn't really matter, and we'll make sure that we get through those today. But just as a little overview, we're going to be talking about a subject that we deal with a lot in my role as a midwife, and we are constantly dealing with women who have had a miscarriage. This is sort of common fodder as part of our everyday routine, and we were just chatting a little bit about that in that little green room beforehand, talking about how that everyday sort of, or every week kind of dealing of it can sort of glaze us over a little bit sometimes, which is not necessarily ideal for the woman. But so we're going to, Sunita's going to be telling us about navigating life after pregnancy loss. And, you know, it was really after finding herself, feeling a little bit lost without a map through her own experiences of pregnancy loss, that she got, you know, committed to and decreasing the stigma around this, and has written some fantastic books on the topic. So I will let Sunita introduce herself to you, and you know, go through her background and whatnot in a little bit more depth. But welcome, Sunita. So I want to hand over to you because I know that you've got a PowerPoint that you're going to start to share with us as well.
Let me go ahead and get that set up here. Let's see. How's that? Seeing it okay?
Oh, that's perfect.
Excellent. Hey, well, thank you so much, Kathy. I'm so excited to be here. Yeah, I'd love to start off by sharing a little bit about myself. And I always like to share about myself through story rather than just anything else. And so I want to talk about why I'm here talking about this conversation, and why this means so much to me professionally, personally as well, too. So I'm going to start by sharing with you guys a little story about myself. So quite a few years ago, my husband and I decided that we were ready to start our family. And I know they say there's no such thing as a perfect time, but it felt like we were so close to what could have been a perfect time in our life to start our family. We lived in a suburban house close to my parents, had these jobs that were very stable and great, and it felt like all the cards were aligned. And we were lucky enough to get pregnant, and pretty quickly. And there's something about when you get pregnant, for myself and so many of my clients, I've heard this as well, is that immediately all these dreams really start to get cemented for you. You start to imagine, what's it going to be like being pregnant during the holidays, getting all this attention from my family, and then having this baby and spending time with them, names and all this kind of different stuff. All of these dreams you just get so excited and attached to immediately when you find out that you're pregnant. And then we found out that we were having a miscarriage. And I remember being just so devastated and angry and shocked and confused, because I had this idea, and Kathy and I were kind of touching on this before, of this idea that linear equation almost of pregnancy equals baby, that there was nothing that should go in between that. And I have come to learn there's a lot that can go between those two things. And we did what a lot of people do after they experience pregnancy loss. We tried to get pregnant again. and very quickly, hoping that if we did, this would be just a sad footnote in an otherwise very happy story. And we were fortunate enough to get pregnant again and quickly. And then we had another miscarriage. And it was at this point that I realized, okay, we can't just keep going here. I need a pause. I need some time to myself. We need some time to heal. And it was during this time that two big things really stuck out to me. The first was that pregnancy loss affects so many of us. We were pretty open sharing our experiences with people. And pretty much every single time we did, the reaction we would get from someone was that, oh yeah, that happened to my mom too, or my sister, or to me. It got to the point that I was just waiting to hear, what is someone's shared connection to this topic whenever I bring it up, because it felt like it was always in the room. So that was the one big thing, that I felt like this happens to so many of us. And I may have known that going into this, but there's something about the lived experience that really highlighted that. And that was what the second thing was, is even though this happens to so many of us, it doesn't feel like we're talking about it enough. And it doesn't feel like we're talking about what the realities are of this and the resources to help support people who experience pregnancy loss. I particularly feel that way when it comes to our training. I know for myself in graduate school, I had one course on grief and loss, and pregnancy loss may have been a sentence in a paragraph, if anything at all. I truly don't remember. So that's what has made it really important to me, is I'm very much on a mission. I have a commitment to start conversations around pregnancy loss. There's a gap there that we need to fill in. What does it mean to actually experience this? What does it mean to understand the grief, to walk through it, so that if a person was to go on and have future pregnancies, that they have had that time to process and grieve and everything else. And that's what we are here to do today, to take some time in that gap. So I want to start off by just talking about, what is pregnancy loss? I imagine most of you guys already know this, but pregnancy loss, think about it as an umbrella term, defined as the death of an unborn baby anytime during pregnancy before 20 weeks. Think about it as a miscarriage, and after 20 weeks is a stillbirth. What's most important to me on this slide that I always want to pay attention to is what we know about pregnancy loss is it's an inherently disempowering experience. It's something in which it feels like my sense of power and control in the world has been taken from me. I don't get to decide if this baby is born. I don't get to decide when I get pregnant again. What I do get to decide, what I want to empower clients, is to use the language that feels most apt to them. For some of my clients, they like to use the word baby. For some, miscarriage, some pregnancy loss, some death. So really something that I would want to just encourage here is, as much as you can, empower clients to use the language, to use the words that feel most true to them and feel most true to their story. So I don't know if this is a game that any of y'all have experience with, but Two Truths and a Lie is a game that I played with in my childhood and is still often used from time to time. Essentially what it is on this slide, which I will read for our people who are listening, there are 3 statements. 2 of them are true. 1 of them is a lie. Something Kathy and I were talking about before this as well too is, in the world of pregnancy loss, there's so much misinformation that is out there. And that can be a really dangerous thing, because when there's misinformation, people make conclusions such as, this is my fault because I don't have any information or reason that tells me otherwise. Or if I'm feeling this way and I don't have any information or education on what it actually feels like after pregnancy loss, I may think there's something wrong with me. So it's incredibly important we take the time to challenge some of these myths, challenge some of the stigma and taboo that may be around these. So I won't ask you guys to say this out loud, but just think internally as I say these statements. What sounds like a truth? What sounds like a lie? Pregnancy loss is relatively common. Pregnancy loss is most often caused by stress, lifting heavy objects, or diet. And last, pregnancy loss can cause significant emotional distress for the non-birthing parent. Okay, let's get ready for the reveal. Okay, pregnancy loss is relatively common. True. 1 in 4 pregnancies end in pregnancy loss, and that is a conservative estimate. Kathy and I were just talking about, really the number is closer to 1 in 3, and that's because sometimes it's not reported, chemical pregnancies, all those sorts of things. And taking that statement alone is so important, that recognizing and normalizing that this is something that happens to other people, that I'm not alone in this, can be so, so powerful to someone. And at the same time, it's so important to know that even though this is normal, it may not be normal for me, and it may not be something that I'd ever expected was going to happen in my life. The second one, pregnancy loss is most often caused by stress, lifting heavy objects, or a diet. Imagine you guys all knew this. Lie. Very much a lie. The majority of pregnancy losses are caused by chromosomal abnormalities. This, again, is something that I am continuously surprised and saddened by how many of my clients come in with the fear, with the belief that this was my fault, that because I ate this type of cheese, because I was moving before I knew that I was supposed to, but because I worked out too hard, that's why I had this pregnancy loss. And that happens again because the information isn't out there. People aren't talking about this enough. So in the face of uncertainty, I fill in the blanks. And the easiest thing to blame sometimes is myself, because at least I can control myself. So this one, very much the lie. And last, pregnancy loss can cause significant emotional distress for the non-birthing partner. Very true. It's well established that both partners experience grief, but they're going to express it in different ways. And we're going to talk about this a little bit more down the line, talking about the non-birthing partner's experience of loss. A lot of times they can get left behind, and when they're not talked about, when they are not asked about their experience, they may form the conclusion that something is wrong with me, that I am feeling this way, or that I shouldn't be feeling sad or upset or anything else, or I should be doing something altogether. Really, what's important here is that we need to recognize that there's a lot of misinformation that's out there around pregnancy loss, and it's really, really significant in our role as healthcare providers, or even just as people to our friends, family, loved ones, that we can be there to be curious about some of these statements, to check in on them and see what actually feels true here and what can be challenged. That education, that normalization can make all the world of a difference to someone. Okay, there are two big concepts that I would love everyone to take away when it comes to pregnancy loss. The first is our reproductive story. Our reproductive story is our narrative of parenthood. It is something that begins weaving in childhood. If you were to think about a toy that you had, action figure that you had, that you played with, that you took care of, that you fed, that you played with, that maybe you took care of it when you were sick. I remember I had the stuffed dog named Skippy that I played with to a very long age, that I used to put to sleep at night, that I would make clothes for, and all sorts of things. That was the beginning of my reproductive story. That was the beginning of me stepping into a parental role. And even if someone decides not to have children, doesn't have children, they have some version of a reproductive story. This story can be impacted by my family. So if I grew up in a big family, maybe I imagine what it's like to have a big family myself. I always picture that for myself. Or potentially I imagined having a small family, just me, my partner, and my child, and imagine what that kind of intimacy would be like. Culturally, every culture has some type of story or belief around children, while it may differ from culture to culture. And certainly our environment has a lot to tell us about children and being parents. If you think about really any of the movies that we're exposed to, oftentimes two people meet, they fall in love, maybe they get married, and then they have a kid. It may not always be in that order, but kids seem to always be the bottom line there. It almost becomes this question of, when I'm an adult, what am I to do except become a parent? And if I can't become a parent, does that make me less of an adult? It could almost feel like that developmental train gets thrown off the tracks, and I'm left unsure where to go next. And that's a challenge with pregnancy loss. It fundamentally disrupts that reproductive story that we've been holding. So I had mentioned to you guys before that when I became pregnant the first time, I had all these visions of what it was going to like to be pregnant, to have a baby and everything else. And very specifically, those dreams got cemented. They weren't created. The dreams that I had, they lasted decades before then. I've been thinking about them, consciously or not, since I was a child. So one thing I'll tell my clients when they will maybe question, like, why do I feel so upset? This has only been 6 weeks that I've been pregnant. What I will encourage them to recognize is that it's not 6 weeks of pain or grief that you are mourning here. It's decades of dreams and hopes and ideas and beliefs that you've been forming and reforming for a good portion of your life. And what we need to do to move towards healing is we need to be able to tell that reproductive story again and again until we can integrate it into ourselves. So let me give you guys an example of what I mean. I had a client that I worked with for quite a while, and The client examples that I give, by the way, I've changed some of the information just to make it confidential and to protect their confidentiality. But this client had a vision of what it was going to be like for her to have kids. She always pictured having 2 kids, being in the state that she grew up in, and loving family. A dog was a big part of it. A bird was also a big part of it. And even had it all mapped out. It's going to be when she graduated from med school and before she got really deep into residency, everything else. That version of her story didn't happen. She didn't really acknowledge that at that point as she kept going with her career. Later on, when she sees me in my office, she is deciding to pursue single parenthood. She's using a donor sperm and going through that process. And there was a point after she got through the transfer and she had a miscarriage, and we were talking about all the grief and everything that comes with that. She said, I never thought my life was going to be like this. I never thought it was going to look like this. And that statement alone, I never thought it was going to look like this. That is our clue that if someone's reproductive story has been disrupted, has been shattered, truly. And so I asked her to tell me, what was the story you imagined for yourself? Tell me what you expected was going to happen. And she told me the story. She told me about the story about the dog and the bird and the 2 kids after med school. And she needed to tell that story to me again and again and to grieve that story before she could begin reauthoring and naming what a new story was going to be for her. And that will be the piece that I would really encourage you to pay attention to. If you're sitting with someone who says, I never thought my life was going to look this way. I never thought it was going to be like this. I pictured something different. Take that moment, if you can, encourage someone else in their life to ask them, what did you imagine your life was going to be? What did you imagine this was going to look like for you? Sometimes we have this fear that I'm going to be reminding them of something they don't have, but believe me, they're thinking about it. We're thinking about it. And we need to be able to tell that story again and again until we can start to reimagine what our story could be. The other concept I want us to pay attention to is reproductive trauma. So we think about reproductive trauma, like any of the layers of trauma that can occur during the birthing experience or the trying to conceive experience. So this could be things like birth trauma. This could be certainly pregnancy loss. It could be things like a failed transfer during IVF. Clients may present with symptoms of PTSD, including continual reliving of the event. So for many of my clients, they may describe, I just keep picturing that moment of seeing the ultrasound again. And one of the challenges I would say with pregnancy loss, particularly as clients hope to get pregnant again or going back to the doctor's appointments and all those kind of different things, is that there's so many reminders of them. They get to the point of being in the waiting room in the doctor's office or the midwife's office it can be just really activating for me. And that'll be something that I will really try to encourage them to, okay, what can we do? Knowing that this can be really hard. Maybe we make sure that you bring your book with you so that you're in the waiting room, you have something else to focus on in that time, or you bring a friend or a loved one, knowing that those reminders will really stay with you. A need to avoid stimuli that reminds them of the event. This can also be a particularly challenging one, knowing that many of the folks who experience pregnancy loss are in their reproductive years. Typically their friend group also are in their reproductive years. So they have baby showers, they have other people's babies or cousins or things like that, nieces and nephews that they want to be around, they want to pay attention to and love and everything else. But it reminds them, it all serves as reminders. And it becomes this painful experience of not only do I feel sadness and grief and disappointment, now I also feel shame for feeling those things, because why can't I be excited for this other person? Why can't I just be focusing on my love and connection with this other person rather than the feelings that I'm having? And that can be just really compounded there. Something else we may see is significant emotional arousal and or emotional numbing as well too. So I may have someone on one end of the spectrum who's feeling just out of control, overwhelmed and sad and depressed and everything else. Or on the other side, I may be feeling really apathetic and numb and just completely shut down. And I may feel a combination of all those in the same day, which can be exhausting. Some other things we may see is flashbacks, nightmares, sleep problems, might feel kind of irritable, and some of those mood disturbances we mentioned as well. Something else to pay attention to here as well is, again, with just the chronic nature of this, some of the reminders is for some clients, getting my period again each month can just serve as a reminder again of the loss and what's not happening now. That first period after a pregnancy loss can be really painful because I didn't expect that this was going to happen. I hadn't anticipated or planned for this. what can be really helpful with this is both some of just the education of what can be expected during this time and what can be, even as painful it is, that normal, in the sense that you're not alone here. Some things we want to pay attention to is if someone has a history of depression, anxiety, past trauma, that can certainly elevate some of these symptoms. And again, something that is important to recognize too is this building upon past reproductive trauma as well? Is this my second miscarriage? I can say, as someone who's experienced 2 miscarriages, the second time you experience it doesn't necessarily, you're not prepared for it. There is almost another layer of pain that can be there that just compounds again. So there's going to be just certain specific things you want to pay attention to in supporting people who experience reproductive trauma. Infertility and fertility treatment. So this is a really important one here. Having had quite a few really important conversations about pregnancy loss, a common comment I would get is like, can we talk about infertility and this 2 infertility treatments, which I think is spot on, because there's so much overlap here, both into some of the experiences that someone may have, as well as the losses that someone can experience. So when we think about infertility, it's defined as the inability to conceive after 12 months of unprotected sex. Some of the options that can occur can be medication, in vitro fertilization, IUI, surgery, and use of a donor specimen. Each of those can carry their own pain, stressors, stress points, things like that. But the last section there is the point that I really want us to spend some time on. Is it's really important to consider that numerous losses can occur in this process, right? So if I think about the client that I mentioned to you before, she went through the process of IVF. And in each of those, she had to keep revisioning and grieving her past reproductive story again and again in order to keep making steps in the process. So first she had this vision of the dog and the bird and the 2 kids and everything else. And because that didn't happen, she had to revision that and imagine, okay, I'm going to do this on my own. And she did do it on her own. And she had a miscarriage. And that was certainly a loss. But along the way, there's other losses that can occur. There can be the loss of, as I start this process, and does the embryos make it to that stage of being chromosomally normal? Are we able, does the transfer be successful? All those kind of pieces, all the different losses that I have to either confront or even anticipate happening. And again, if I'm building on past reproductive trauma, there may be just a lot I'm holding with me. And it can make a world of a difference when someone else can recognize that and can even use the word that this is a loss, that when a transfer is unsuccessful, that is a loss. There's a true death that has happened there, a death of a dream, a death of a hope that you had. And that alone can make someone feel incredibly validated and seen and understood. Something that can also be really challenging in this process is having to manage grief while also making decisions about next treatment steps. You can have to go from, I'm being told in this doctor's appointment that I'm having a miscarriage, to then being asked, so what do you want to do with the embryos that you have left? That can be so overwhelming and confusing to have to both hold my grief as well as my anticipation and readiness for the next steps at the same time. Very much what I will encourage people in those moments is you are allowed to feel many things at once. You can make the next step even while holding the grief at the same time. And you're allowed to pause. You're allowed to slow down if you need to. And last, just managing the stressors of the medical system. It can be incredibly challenging when you're in this process to get clarity, to get straight answers. And this can depend on the medical system or your provider that you're actually working with, but can you just feel like another stressor in this process? And this is all stuff that we want to keep in mind when we're just thinking about in this experience of pregnancy loss. It's more than the pregnancy that is lost. We've touched on this a little bit, but I want to guide you guys through just some specific layers here that I think are vital in understanding this very unique experience. So first, one of the losses we want to think about is the loss of one's sense of self that can occur from a miscarriage. So what I had mentioned earlier is there's this idea that adulthood and parenthood can become synonymous, that I imagine, just like my client did, okay, I map it out that once I get to after med school, that I'm going to have a baby. That's what I do. But if I can't become a parent, does that make me less of an adult? Does this make me less of a person in some way? Can also get connected to our gender identity. Oftentimes motherhood and womanhood become synonymous. So I have this idea, I can't be a mother. Does that make me less of a woman? Or if I'm a man, if I'm not able to have a child, does that make me less of a man? Do I question my virility because of this? So it can really get to the core sense of my person and be incredibly destabilizing. Another loss I may experience is loss of control and trust in the world. So something we use in our trauma work is this concept called the just world theory. The just world theory says good things happen to good people, bad things happen to bad people. Many people who experience trauma have this belief until the trauma happens to them. And it rocks this belief to the core, because I may now have this idea of, okay, I thought I was a good person, but now I had a miscarriage. Does this mean that I'm actually a bad person? Or does this mean that this fundamental belief I've held throughout my life isn't actually true anymore, which can also, again, be very destabilizing. This can also go into my sense of my body as well, to my control and my trust in my body, that I always thought if I do this thing, so if I go to sleep at night, go to sleep early, then I'm going to feel well rested the next day. If I eat well, my body's going to feel energized. If I take care of myself during pregnancy, then I'm going to have a healthy pregnancy. But when I have that loss of pregnancy, I start to lose control and trust in the world. My beliefs truly get shook up. And this can very much rest upon past trauma history. So I have an experience where I already didn't really believe that good things happen to me. I didn't really feel like I had a lot of trust in the world. This is just going to go ahead and reinforce that even deeper. So that'll be something else we want to pay attention to when we are supporting people in this experience. Another layer of loss, maybe like the most obvious, is the loss of parenthood. One thing that I hear from a lot of my clients, particularly those, specifically those who this is their first experience of pregnancy, and this is going to be their first child, is this excitement of, I'm finally going to be joining this exclusive parenthood club. You know, I think about a client of mine who, she was the last in her friend group to become pregnant. And, you know, all of her friends had been telling her for years, like, oh, you know, we can't wait, you're going to love it, X, Y, and Z. And when she found out that she was pregnant, they immediately started flooding her with all sorts of things of like, you're going to love this app. Here are the products we use. Oh, you should start coming to these play dates with us, get all the experience, all this kind of different stuff. And once she found out that she was having a miscarriage at 10 weeks, all those invitations and messages started to really dial back. And it wasn't out of a desire to exclude her or anything else like that, but more likely to protect her. But what I felt like for her was like, oh my gosh, I was so excited to finally be a part of this group, of this community. And now I'm not in there anymore. I'm not a parent anymore, even though I felt like it. It felt true to me. And again, that's something that I would very much empower clients and individuals to take on of, do I still hold on to this parent identity? What does that mean to me specifically? Something else that we think about this is pregnancy loss certainly doesn't just affect the individual, it affects the entire system. For many folks, there is the loss of parenthood, but there's also the loss of grandparenthood to consider, the loss of being an aunt or an uncle. I remember a client of mine that I was working with whose daughter had had a miscarriage, and she felt so insensitive saying this, and she didn't share this with her, she was just saying it with me of, you know, I'm grieving too. All of my friends, they have grandkids. And I was so excited to finally be able to be one showing the pictures and sharing the stories and being able to spoil this grandchild of mine. And the grief that she carried, that this is a loss that really reverberated throughout the entire system. A loss of feeling healthy and normal. So for a lot of folks who have had the privilege to be healthy and have healthy bodies before this may have really just shook up that identity with my body, like we were talking about before, where, for example, if someone needed to go have a surgery and have a D&C afterwards, it may be the first time I'm donning a hospital gown and have that hospital ID bracelet, where I have that role of identified patient here. And that can be just so, again, confusing and painful. If I've always been healthy, why did this happen to me? There was nothing that my body said that something was wrong. Why did this happen to me? So again, there could be another piece here where I don't feel at home in my own body. There's something that is lost here, and that is my sense of safety in my body. And there's a lot in here that can get tied up into really trying to repair and recover my relationship with my body, particularly in subsequent pregnancies. Something else that lost is the loss of the innocent experience of pregnancy and childbirth. As I mentioned before, a lot of us know these statistics of how common pregnancy loss can be. But speaking for myself, I can know the statistic and still think, but that's not going to happen to me. I'm not going to be that person. I'm going to have that beautiful experience of being pregnant in the holidays and Christmas. And when you lose that, when I lost that, I lost also not just the pregnancy and the baby, but I lost this innocent experience of pregnancy that I had before. Then the second time I got pregnant, I wasn't picturing being pregnant during the holidays. I wasn't picturing names or picturing times with my family. I was just picturing, please have a healthy and safe pregnancy. Your mindset truly shifts. And there is a loss there. There's a loss of being able to live out those dreams that I'd wanted for so long. And that carries through for pregnancy, and it can carry through to childbirth as well too, that even if, I've had some clients who've had a miscarriage and they go on to have a healthy pregnancy afterwards, when it gets to the point of childbirth, even though their pregnancy has been healthy up to that point, up to the point of childbirth, there's still so much fear they carry into the room, because it feels like, one client described it to me like this. It was almost like you're told the boogeyman doesn't exist. I'm sure if that's a concept that everyone talks about, but essentially like a monster, that boogeyman does not exist. But then when you have a miscarriage, it's like a boogeyman, you learn it's real and it's actually out there in the world. And now that I know it's real, I can't stop thinking about it. Even when I'm at 39 and a half weeks and I'm about to give birth to my baby, I'm thinking, can this be all taken away from me again without any control of myself? So it can really stay with us in subsequent pregnancies. Another big thing is loss of sexual intimacy and privacy. So there's something about having a pregnancy loss that can just put your sexual intimacy under a microscope, where you are told, okay, there are limits to how much time you have to take before you're able to try again. Or maybe you're even told, okay, you can try, but you have to use contraceptive measures, which can really just be a painful thing when all you want is to try to conceive, to have a baby. So it can just be like another layer of loss of something that's being taken away from me. And last, but certainly not least, is a loss of financial freedom. This can be such a big one for folks. And again, speaking from personal experience, as well as from many clients who have shared this with me, at least in the American medical system, some of the stuff that we've experienced is having a pregnancy loss, a miscarriage can be incredibly expensive, which can at times can feel almost like insult added to injury, in a sense where I've not only experienced this loss and all the layers that we're talking about here, but now I have to pay so much in order for this to happen. And then I'll say for myself, having had 2 miscarriages and having been fortunate enough to birth a healthy pregnancy, my daughter, it was more expensive for me to have had 2 miscarriages than to have had my daughter. And there's something about that that can just be so exhausting and painful to think about. And it can lead to some of that, even that comparison piece of like, why did this have to happen to me? How come no one else has to deal with this? And that's part of the reason why it's so important to talk about these losses. Something one of my coworkers mentioned recently is that a very close cousin to grief is resentment. And if we don't spend time talking about grief, talking about all these layers of losses that are here and having someone validate them, that they are true and they are real, other really painful emotions can start to show up, like resentment and jealousy and other things like that, that make it really hard to connect and feel connected with others. So this is a tool I like to use with clients quite a lot, and even just show them this and ask them, like, where do you see yourself on this journey? Where did you find yourself in some of these losses? Okay, so we've talked a little bit about the what, we've talked about the why, we've talked about some of the different experiences you can have. Let's talk about, how do we actually support people who are in the room who are experiencing these losses? Starting with grief treatment. So I want to talk about just a general broad thing to keep in mind is the loss and restoration orientation when it comes to grief. Think about this like a pendulum. It's very important that people are able to go back and forth, moving between loss and restoration. When we talk about loss, it's everything we've just talked about. It's talking about, let's make space for all the layers that are in here, the dreams you had, your reproductive story, the feelings around pregnancy that you were hoping for, really being able to name concepts like disenfranchised grief, which is grief that's not readily or accepted by society. So that can be pregnancy loss, that can be a loss of an ex-spouse, the death of a pet, things that people don't quite count as grief, but are certainly grief, things that can make us minimize what we're feeling. So it's really taking that time to be able to acknowledge and validate that loss. This can also be a really beautiful time for rituals. So within someone's culture, is there a grief ritual that feels important to you? Is there something that I can keep in mind when it comes to helping you through this that your culture utilizes? And a little note I have here at the bottom is pregnancy loss triggers the attachment system. And what that is essentially it's our connection system. And it's going to remain activated until that person finds a way to connect with that loss. So what I mean by that, and I'll use the example I mentioned earlier with my client, is we form a relationship with our pregnancy. And that relationship has decades of history to it. And until I can find a way to connect with that loss and grieve it, it's going to remain to be activated. It's going to remain to be overwhelming to me, even if I can't consciously name why it is, which is why it's so important that we spend some time in the loss orientation talking about it. Just as importantly, we need to be able to swing like a pendulum, moving from loss to restoration. Restoration are those pieces of thinking about funeral arrangements, if that's necessary, thinking about physical recovery, doctor's appointments, goals and hopes for the future. This can also include healthy distractions. So let me think about things that are connection with friends, thinking about hobbies, things that I really enjoy. Something I'll mention here is re-engaging with yourself. There's something about pregnancy that can be all-consuming, that once you find out you're pregnant, it's as if one of my clients described it like this once, of all the tabs on your browser change. So from looking at, for her, looking at like restaurant menus or schedule events on the weekend or online shopping, things like that, she started to look at things like Bye Bye Baby or shopping for baby stuff or looking at things about pregnancy. It's like everything in her life started to revolve around this topic. And something that can be really helpful in this stage of the restoration is, can I remind myself of the things that really matter to me, the strengths that I have and the hobbies that I really care about, and let myself re-engage with those, and being able to re-engage with other people in my life who I care about. What's going to be really important here is being able to have that pendulum there. So if you see a client who seems really stuck in a certain place, where there seems like they are just like, go, go, go with the action, or it seems like they are just so deeply overwhelmed by their feelings and what's going on with them, it may be that there's a gentle nudge that's needed to, okay, if I'm just feeling really overwhelmed by my sadness and everything else, can we gently nudge that pendulum to the restoration? Can we check in with some ideas, some hopes you have for your future, while still acknowledging the pain that is there? You can do both at the same time. And similarly, if you have a client who's go, 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 all I care about is next steps, can we help them slow down for a second and look into some of these losses that they're experiencing? Something I will say again and again is, we often have the fear that by talking about it, by naming it, by bringing it into the room, am I reminding them of something? Am I going to bring something up they weren't even talking about? Believe me, they're thinking about it. Even if it's not conscious, it is there and it needs to be addressed in some way. And it is so, so validating when someone else is the one who invites it into the room. Speaking of others, I want to share with you guys a few really short, tangible exercises and ideas that I will bring into the therapy room, though I think really it could be used as a tool in many different kind of healthcare provider spaces. So one of them is called the creating a help card. I have a stack of these in my office, and actually a few of the midwives that I work with here in Houston also have a few as well too. What a help card is this is a surefire way to get your needs met by someone else in your life. You create a script that says, when I feel certain emotions sad, I need you to say, I am here for you. What I need you to do is sit next to me, bring me a blanket and hold my hands. Oftentimes we have this hope expectation that if someone knows me well enough, they should be able to take care of me. They should be able to know what I need in that moment. And while, sure, I think sometimes that is going to be the case, more often than not, I have people do this exercise themselves and they actually struggle to figure it out because we don't always know what we need. Day by day, moment by moment, I may be changing my mind. So just imagine what it's like on the other side, someone else trying to figure out, how do I support you right now in this moment that maybe neither of us have ever experienced before? So these help cards are very much for the person who is needing support and for the person who's giving them support. Let's make sure that everyone is taken care of. And It can sometimes be good practice. If the person's like, I'm not sure if I have anyone in my life who I can give this to, let them practice with you if you feel you're up to it. It can be something simple as like, hey, when I'm feeling anxious, I need you to say, I'm here to answer any questions you may have. What I need you to do is just take your time with me and ask me if I'm okay. And let them practice with you and encourage them to give that to someone in their life. It can make such a big difference. And when we have time, and when I've done this exercise in the past, I've also encouraged participants, like those of you listening, to please try one of these yourself. Any exercise I give to my clients, I will always do them myself, just so that I can even speak to some of the barriers that I experience. Just like I said right there, that comes from personal experience of why should I have to tell someone what I need? Because I don't always even know. So I very much encourage you to fill out a help card for yourself and encourage those around you to do it as well. Let's talk about the partner. So the partner's experience of pregnancy loss is something that is not talked about enough at all. Non-birthing partners often experience what we call delayed grief. What we've seen actually, and actually it's kind of interesting, this is what we see both as well in pregnancy as well too for birthing parents, is the non-birthing partner often experiences symptoms 3 to 6 months after the experience. So that's with a pregnancy as well as with pregnancy loss. Grief tends to show up 3 to 6 months afterwards. One of the big reasons why this could be is that there's a lot of attention on the birthing person after their loss. There's the attention on them by the providers at the doctor's appointments, by friends and loved ones, which is great, which is helpful, which is necessary. And at the same time, the non-birthing partners can get left out of this. They can be so focused on, okay, we got to focus on the birthing person, that their needs go on the back burner. Thinking of our own experience, after we had had our miscarriages, my husband had a lot of folks checking in on us and specifically asking like, hey, how is Sunny doing? How's she feeling? What's going on? Can we send her anything? All that kind of stuff, which was so appreciated and so beautiful for them to do. And at the same time, no one actually checked in on, hey, how are you doing? How are you feeling with this? This must be so hard for you, because the expectation was it is the birthing person who is suffering. It is the birthing person who is in pain. But what research tells us is that both people are very much affected by this. And actually, in reality, what we see is that the more couples can share with each other how they are experiencing this, that they are experiencing distress around this, the greater they will both report a level of closeness and lower levels of emotional distress. I can say this is very, very true, speaking as a couples therapist as well too. And one of my favorite couples to work with are those in the perinatal time period, including after pregnancy loss. And I remember one couple in specific, one of the partners experiencing a lot of grief, a lot of just pain after their miscarriage. And one of her biggest stressors is that she just felt completely disconnected from her partner, who just wanted to make sure that she was okay. He was always tending to her, bringing her things. And when she would ask him, how are you doing? He would again and again say, fine, I'm good. And just work on doing and fixing. And that's the thing, is that is often what men specifically are told to do. They need to focus on doing and fixing and not expressing your emotions. But what can make the world of a difference to people, including my client, is hearing, this hurt me too. You were not alone in this. This really impacted me, and I am sad with you. This is a dream that I had as well too. So it can be just incredibly vital to ask non-birthing partners about their experience. And that's something that we can do in the room. So if I have a client I'm working with individually, I will ask her, how do you think this is impacting your partner? And similarly, if I have a couple in the room, I will certainly do that as well too. And I think it's something that, whether it's OBs, midwives, doulas, being able to include the non-birthing partner in the conversation of, what has this been like for you? Let's start that conversation so that they can continue it outside of our offices. So helping clients find their rainbows. This is a concept that some of y'all, I imagine, may be familiar with. It's often used over here, of essentially at the end of a storm of infertility or pregnancy loss, a rainbow baby is the baby we have after that. It's kind of like the joy, the reward after that stormy period. But there's a piece here where I think it's so empowering and liberating to be able to help clients redefine what does rainbow mean to them. Sometimes it truly is a baby, but sometimes it can mean something else. Maybe rainbow is really reinvesting in my relationships or in my job or that side hustle or business I was always looking forward to. It reminds me of a client I had who she and her partner had been trying to get pregnant for years, and they were trying IUI and then IVF. And then after many tries, they finally got pregnant and they had their baby. They were pregnant and then they had a miscarriage. And at that point, she had come across the term rainbow baby. She's like, I just got to wait for my rainbow baby. I have to just wait for my rainbow baby to be there. And very much I was on team, like, let us get that rainbow for you. But one thing we want to explore is, what does rainbow actually mean to her? Is the rainbow the baby, or is it something else in her life? And one of the things that we were able to do is trying out different endings of her story. One possible ending of her story was to keep pursuing IVF to have that rainbow baby. Other story she was thinking about was a dream that she had actually been holding with her partner for a while. They really wanted to open a bed and breakfast. That was actually like a vision, a dream they've been holding for decades as well. And so we spent a lot of time being able to just try out those endings of imagining the story in which you pursued having this rainbow baby. What did that look like? And then we tried out this other ending of, what about if you have this other rainbow that looked like a bed and breakfast in the hill country with your husbands, and then you guys have been thinking about for so long? And she went back and forth for a while, but ultimately what she ended up doing was pursuing the bed and breakfast. Maybe she'll go back and potentially try to have a baby in the future. But there was something that felt incredibly liberating and empowering for her of, my rainbow doesn't have to be a baby. It can be whatever I want it to be. I'm allowed to choose that. And again, in an experience that is so disempowering, that feels like it's taking all of our choices away, we want to do whatever we can to help clients feel like they have autonomy, they have some choice in what form their story takes. So as a therapist, I must include this slide, that it's so important to think about, how do we support ourselves in doing this kind of work? Helping people navigate any kind of loss is incredibly hard. It can bring up a lot in ourselves, particularly if we are navigating our own reproductive stories. I know that's something for myself in helping clients, of just how much it can remind me of my own story. So it's vital that I and all of us take care of ourselves, whether that is, again, bias to your butt, therapy, seeking comfort from others. I imagine in groups like this, journaling, and just really being able to think about, what are the ways that I take care of myself? What are the ways that I consider how I can be nourished so that I can nourish and take care of others? So a couple more things I want to share with you guys before we move to any questions, thoughts we have are few resources here. So I have some books, some podcasts that I really enjoy. Something that I always like to break it down is different websites and resources based on the type of loss we're talking about here. So there's one specifically for pregnancy loss versus stillbirth. And then just a couple of other exercises that I use with clients. So certain journal prompts that you can use, just helping people get at their reproductive story. Something else that's been really helpful is being able to create a simple loss history graph. So really helping clients actually like chart out the beginning of this experience so they can actually explore each of these and what happened for each of them, really gaining a full scope of what they've experienced. And another exercise here is knowing that shame is such an inherent part of this. It's being able to name some of these out loud, being able to hear them with someone who's compassionate and can challenge them with you. And last, and again, this is something that I would recommend all of us to use, I have a pad of permission slips in my office where I will encourage people to give yourself permission, just like we used to have those old school permission slips when we go on field trips, things like that. Give yourself permission to say yes, to say no, to change your mind, and do what is right for you, whatever it takes to take care of yourself in this moment. Okay. And I want to just thank you guys for talking about this and breaking the silence around this very vital topic. Go ahead and stop sharing. Okay.
Oh, that's so great. Thank you so much, Sunita. You've given some incredible depth into this topic. And
Thank you.
You really have. I think that we as a lot of some of us from IMCO volunteer on the Ask the Maternity Gurus Facebook forum, and we are dealing with miscarriage questions continuously. It's just such an area that when women become pregnant, they often have no knowledge about miscarriage until
Right.
it's just not something that they're familiar with. And that story of you say, that when you've gone through it and you're starting to mention it socially around, then it all kind of comes out of the woodwork. Oh yes,
Right.
I've had some, and my auntie and my mum and my sister.
Yes.
And there's this whole realization of, oh my God, this is not uncommon.
Right.
Yeah, and I know that we sort of spoke a little bit before that statistically with human reproduction, 70% of fertilized eggs never implant. So that's what we call a chemical pregnancy. And then of the 30% that do, roughly about 1/3 of them doesn't continue to successfully establish into a long-term pregnancy. So it's about a 2 in 5 chance every time an egg is fertilized in human reproduction that will result in a successfully established pregnancy. And that kind of, sometimes I think it can be a little freeing almost, that when you realize that this is normal and this is what happens in human reproduction, and as you say, the biggest cause of those natural miscarriages is chromosomal disorders. And it's because Mother Nature is so clever that, most of the babies that are born are healthy, normal babies, right? And the reason that most babies are healthy, normal babies is because of Mother Nature being clever and miscarriaging the ones that she recognizes there's something wrong in that pregnancy or not normal. But it becomes, but certainly when those women are starting to have recurrent miscarriages, so say 2 or 3 miscarriages in a row, then we do within midwifery and obstetrics regard that as not normal.
Right.
Yeah. So that's kind of that red flag in a way, saying, look, if you've had, say, for example, a woman who's had 2 successful pregnancies, but then with the third one, she's having a miscarriage. Well, you'd kind of have to look at that and go, well, that's a statistical average. It's not what she anticipated.
Right.
But it's when you start to see those 2 or 3 or 4 in a row, and you can go, yeah, that's not normal. There's something else going on.
Right.
Yeah, and there's certainly within the more research that we're putting into preconception healthcare, the more we are realizing that makes a huge impact. So epigenetics is what we're talking about, is the genetics before conception, which I know that you'll already know about, but I thought I'd just sort of throw that topic in here. That we know that the quality of the egg, the quality of the sperm, the quality of the womb lining is the 3 big things that can have a huge improvement if the woman has 6 to 12 months of preconception healthcare, and the male partner has, or the provider of the sperm is having 3 to 6 months of preconception healthcare. Because isn't it always that story, Sunita, that when women become pregnant, if they then miscarriage, they will often just assume it's all their fault.
Yes.
Their body, right? It's their thing.
Right.
And actually, what we know now is the quality of the sperm impacts marriage rates too, right?
For sure.
Right, yeah. And so that's a big deal. And when we've got couples that are going through subfertility, we know that statistically approximately 40% is female body related, 40% is sperm quality related, 10% is both, and 10% is unknown, thereabouts, so that's a big deal. So the woman have to, I just want to, pick everyone up and go, please realize it's not necessarily you, it's not your body, because you're right, you touched on so many points of the loss that gosh, I thought your summary on those losses was so on point. And just that loss of thinking that your body is normal and healthy and isn't faulty, and there's shame that it doesn't work properly. And actually it could be his sperm.
Exactly.
Yeah.
Yes.
So it could be that quality. So certainly that 6 to 12 months of preconception healthcare is such a good thing to do when people know that they want to be planning to conceive. And some of the other things that you touched on, they were just so good. Can I just throw in there a comment that when women do miscarry, there's often a real unsureness as to what happens next, and suddenly they're like, oh my God, I miscarried last week, do I have to have a D&C today, type of thing. And if it is, again, is a real general summary, but in usual terms, the management would be that we wait sort of 2 or 3 weeks of what we call expectant management of that woman's womb naturally expelling or discharging the those what we call products of conception, so the pregnancy tissue. And if your body doesn't do that sort of within 2 or 3 weeks, then the next step would be medical management, which is when you're given some pills to help expel that tissue, and that should work within a couple of days. And if that doesn't work, then going on to the surgical management of the D&C. But I do feel like sometimes the D&C is really rushed, and it's right. It becomes almost like the first thing, and because women want to they don't want to be carrying around what they know is a deceased baby. That's tough. But if it can help with anybody, I encourage women to try to hold back on the D&C, because we know that using that curettage on the womb lining can leave its own scar tissue. So it's not helping it will not saying it's going to hinder, but it could potentially hinder fertility. So better if we can just let the body do what the body naturally wants to do, which is most times. Other sort of comments I thought I might throw in there is, gosh, that that whole loss of your reproductive story comment I thought was so on point, that I never thought my life was going to be like this. That adulthood equals parenthood, and it's kind of that losing your purpose. Like, hold on, that was going to be what I did. I was going to be a mum. And so there is such that grieving. You're so right, and that sort of deep overwhelming of the thing that it wasn't what you planned, and as soon as you do fall pregnant, oftentimes, isn't it, we do just go, that's it, instantly. You're looking, I love the
plan happened.
The tabs on the page. Totally in there.
It's so true.
I mean, at the same time, 50% of pregnancies are unplanned. So women that are going through a different kind of grieving process.
Such a good point.
And that sometimes their miscarriages are just their, gift from heaven, as far as they're concerned. And other times they're like, oh my God, I'm grieving the fact that I was planning to do this, and this, and now I can't. So there's but then that's not helpful for the women who are having miscarriage, because they just, that feeling of jealousy and resentment is it's hard not to be there, isn't it?
Yes.
And sometimes maybe just knowing that what is statistically normal, and knowing when things are not normal and what you can then, do to hopefully improve that situation. We do, I think that in the West, we handle grief. You'd probably agree on this one. We don't handle grief that well in the West.
Very much agree with that. Yes. Yes.
Right. It's just, and
so bad.
yeah, we just don't. And a lot of Indigenous cultures just do it. They do grief way better.
Yes.
Right. There are rituals, there's healing, there's recognition, and yeah, it can be such a very alone journey. Is it possible to show, we've got a question here, that resources page again from the slide? Yes, that's fine.
Sure.
I will just share the screen again.
Resources.
And you guys
resource list.
take a screenshot perhaps of that. And as we come to a close, do you want to just also finally go over, Sunita, your contact details as well? Yeah.
Yes. Yeah. You can reach me at the website at drsunitaosborne.com. I'm also on Instagram at dr.sunitaosborne as well. And I'm happy to answer any questions, anything. I am very much in the world of resources. I mean, this is a very short list, but I have more resources and exercises and all that kind of stuff. And one of my favorite parts of being able to, sorry, I kept moving that. Now I'm on that again. One of my favorite parts about being able to have these kind of conversations is getting connected with other providers and people who are in this world. So there's ever a time you're like, wondering, do you have a book recommendation? Do you have a website that is helpful for this client who's in this situation? I'm happy to either share with you what I have or even try to do some detective work myself and find it, because I think it's just so important that people find a place to land that feels like it matches their experience. So happy to help with that.
Oh, that is awesome. So thank you. Look, we are out of time, but thank you so much, Sunny, for your time today. It's incredibly appreciated. You've got a beautiful level of depth into those. I love the slide, particularly with all those various losses. It's so true.
Thank you.
Yeah, it's and then you've got women who, it's such a different experience for somebody, say, perhaps who've had a 6-week miscarriage,
right,
and somebody who's had a 26-week miscarriage. Yeah, and their journeys are very, very different as well. So you cut the line down before sort of the miscarriages under 20 weeks and stillbirths over 20 weeks. And yeah, that's that whole sort of way that obstetrics regards it internationally. But another sort of almost line in the sand on that is that oftentimes a miscarriage under 20 weeks can be dealt with the ways that I talked of before. But often with over 20 weeks, it is giving birth.
Yeah.
And many countries around the world require that child to have a birth certificate and to have a funeral or a cremation. It gets treated as an existing being that was born dead. So there's all of that protocol of the birth certificate staff that has to occur, and the funeral, as you say, and whether they're buried or cremated, and all of those decision processes, and just the fact of I don't know that there's something much harder than a woman who is induced into labor knowing she's giving birth to a dead baby.
Yes.
It's just incredibly traumatic. And so they're I guess recognizing in a way that incredible hardship that she's gone through with that. I personally have never gone through that, and I just always I don't know, you would never, I don't know that you can recover, you'd ever recover from that. It's just, you're a different you. It's a line in the sand, and life is changed forever. And that whole, when you talk about that, rug being pulled out from underneath you,
Right.
where you imagined your life would be.
Yeah.
Yeah, it's huge. So look, I as I say, it's we must wind up. And yeah, having been a midwife for quite a long time, we see a lot of stories on this one. And but I think, thank you so much for your overview. It was just beautifully done.
Thank you
And
so much for having
thank you
me.
for the work that you're doing, with helping women through this. And yeah, so I'll let you unshare that page.
Yes,
Hopefully
there we
everybody's
go.
got those resources now, and want to wish everybody a wonderful rest of their day and rest of their week. And we look forward to seeing you that managed to be here live, because we know a lot of you watch it later on. And thanks, Anita, for your time. So thank you,
Thank
everybody.
you. I appreciate it.
Bye.
Bye.